Osun State Governor Senator Ademola Adeleke has announced that private school students will soon benefit from free eye healthcare services. The initiative, which kicked off as a pilot phase targeting public, primary and secondary school pupils, aims to provide comprehensive healthcare screenings and interventions to children across the state. Speaking at the event on Wednesday, which also featured the presentation of corrective eyeglasses and drugs to students and distribution of multimillion naira medical equipment to accredited government hospitals, Governor Adeleke emphasized his administration commitment to ensuring no child is left behind. According to him, the Imole School Eye Health Program has made significant strides, with 345,000 students screened. Of those, over 42,000 were diagnosed with various eye conditions. The governor assured that each student would receive appropriate treatment, including corrective eyeglasses, medication, and surgical procedures at no cost.
It is with great joy that I stand before you today to launch another transformative initiative of this administration, the Imole School Eye Health Program. This initiative is designed to ensure comprehensive eye screening for all pupils and students in public, primary and secondary school across the state. Those identified with visual impairment will receive necessary interventions, including corrective eyeglasses, essential medications, and where required, surgical procedures. So far, we have successfully screened 345,000 students, and over 42,000 have been diagnosed with various degrees of visual challenges. I am pleased to announce that every one of them will receive appropriate treatment at no cost. I repeat, I will announce that every one of them will receive appropriate treatment at no cost. Go offend you, not go along, offend you. I just saw you about offend you.
Governor Adeleke also unveiled an array of medical equipment acquired through the Osun Health Insurance Agency for government health facility under the Osun Health Insurance Scheme. He noted that the investment is designed to elevate the standard of care for all enrollees, adding that his administration remains resolute in upgrading the health sector in fulfillment of his promises.
Intervention in public schools as a pilot phase, and I assure you that we will soon extend it to private school, ensuring that no child is left behind. In addition to this landmark initiative, we are also unveiling multi-million naira worth of medical equipment acquired through the Osun Health Insurance Agency for accredited government health facilities under the Osun Health Insurance Scheme. This investment is aimed at ensuring that all enrollees receive the highest standard of medical care. Our administration remains resolute in regulating health sector in fulfillment of our promises. We have fully approved the training allowance for resident doctors and implemented the full comments and coherent salary structure for health workers, ensuring they receive their entitlement promptly.
The governor praised key stakeholders, including the commissioners for health and education, permanent secretaries, and Dr. Razak Akindele, whom he commended for reviving the health insurance agency.
It is worth noting that this program is a product of the collaborative effort between the Osun Health Insurance Agency and the Osun State Ministry of Education. I extend my sincere appreciation to all stakeholders who made this a reality, including the Honorable Commissioner for Health and Education, the Permanent Secretary of Health and Education, the Chairman Governing Council of TESCO, and the dedicated staff of this ministry. and agencies.
Earlier in his remarks, the Executive Secretary of the Osun Health Insurance Agency, Dr. Razak Akindele, appreciated Governor Adeleke for providing agency with maximum support since the inception of his administration to various initiatives. Dr. Akindele noted that through the Imole School Eye Health Program, the agency discovered over 45,000 students with eye challenges who will be provided with free treatment as directed by the governor.
This is yet another big milestone in the health concern of Mr. Governor for the good people of Osun State. So many interventions before now have been done by His Excellency through our agency, ranging from the free enrollment of pensioners to the enrollment of people living with disability and provision of life support gadgets to them, which cost multi-million naira. The idea of the Imole School Eye Health is construed to bring relief and support to the students of public, primary and secondary school. Quite a lot of students perform poorly in the school, not because they are not intelligent, but because they have problems with their sight. A lot of them do not see what the teacher writes on the board. They do not see what the teacher demonstrates on the board. A lot of them strain to read their books. And what is the result of this? Poor academic performance. There is a concern to Mr. Governor that this must stop and we must give good sight to our students. We started this exercise about 4 weeks ago. We had a series of meetings with the Ministry of Health on how this will go smoothly. We realized from the statistics that we got that there were more than 345,000 students in this category of schools. When we reported to Mr. Governor, he said we must test all of them and provide solutions to their problem. Looking at the enormity of this number, we agree that the first thing to do is to train the teachers so that they can do school-based training for these students. So for about a week, we engage the teachers, more than 400 teachers. We train them how to use visual acuity charts to detect eye challenge in a pupil. And for the following week, they carried out this exercise. From statistics from studies that have been done before, if you screen about 345,000 people, you are likely going to get about 22,000 that will have challenges. We made provision initially for 25,000 students. Unfortunately, as I'm talking to you now, we have reached 45,000 people, students that have eye challenges. We ran back to Mr. Governor and he said all of them must be provided for. And he was ready to give us the maximum support.
Well, my advice to the students is that this program is going to be a continuous program. So those of them that have not been attended to, so to say, they should, when the next program will be on, they should make themselves available, because most of them are afraid to get glasses. Most of them are afraid to get glasses, so they prefer to take drugs. But when they see their colleagues using glasses and seeing well in class, they'll be encouraged. So they will come back to us with the next outreach, and they will be able to help them too. Then to the government, our governor, as you have heard today, is really doing a very good job. So I'm sure he's encouraged today, seeing this number of students that have benefited from this outreach. So I encourage our governor to continue his good deeds. So the Lord will continue to help him and bless him.
Mr. Executive Governor of Osun State, our fathers and mothers in the we say a very big thank you for giving us these classes. That is to say, we have a governor that does not forget us in Osun State, and that we have someone and a mentor and a role model in Osun State. We want us to attain a very great height in future. That's why we decided to help us so as to pursue our academic goals. And we pray Almighty God will continue to bless you and grant you much strength for you to continue with your leadership. May God bless you and your family.
I'm here to thank the
governor for what you have done for us. I thank the governor that he give us glass to see very well and the eyes drop. I thank the governor. May God bless him. He shall live longer. He shall not die. Amen.
Ayobami Abidoye reporting for Am Loaded.